Hi, guys. Okay, so today we're going to talk about the humanistic approach to therapy. Okay, all right. So, humanistic, we remember, is the more unique approach to psychology. Everybody's different, everybody is unique. And so, a lot of their approaches are about studying people who they believe to be psychologically healthy to figure out how to get other people more like them. Okay, so the humanistic perspective, they're trying to reduce the growth of impeding conflicts by helping the clients get insight. So, reduce the impact of their issues by figuring out, well, what's the cause? They boost self fulfillment by helping their patients grow in self awareness and self acceptance, realize what their issues are, and accepting themselves for who they are. They do promote growth as a person, but they don't call it an illness. They don't call a lot of their disorders and issues, they don't call it an illness. And they call their clients, not a patient or a person. They're doing it more, not quite from a medical perspective. To grow, a client must take responsibility for their actions or feelings. So they're not, psychodynamics looking for hidden issues and kind of blaming things on the parents and childhood experiences. And humanistic is like, well, you might have had a cruddy childhood, but your choices are your own. So they're looking at it from a little bit different. They, again, unlike psychodynamic, are focusing on your active thought process. They're not worried about your subconscious or your unknown issues. They're worried about what did you actively think about. And they focus more on your present issues, not anything from your past or your childhood, unlike Freud and psychodynamic perspective. Okay, so humanistic has what's called client-centered therapy. It's developed by Carl Rogers, and it focuses on a person's self-perceptions, how they perceive themselves. So this is what's called non-directive therapy. Your therapist is supposed to listen without judging or interpreting what you're saying, which is big because psychodynamic is all about interpreting. And it kind of lets the client direct the therapy. If the client comes in and they want to talk about a fight that they had with their boyfriend, but last session they were talking about something completely different, the therapist just lets them go. Let them talk about it. What insights can they gather from what they're saying? You don't, as the therapist, direct them towards an insight. You let the patient come up with their own. Rogers emphasized that therapists should exhibit what he called AGE: acceptance, genuineness, and empathy. He said through active listening and acceptance, you're going to get a patient who's comfortable to tell you fully who they are when they don't feel like they're going to get judged, and they will really dive into their issues because they're in a safe space. So active listening is something you've probably realized your teachers or even your guidance counselor has done a time or two, which is echoing what you say, restating it, and seeking clarification based on what you've said. So you're having a conversation with someone and you talk about you felt really pressured by playing the sport. It was a lot on you, and you felt, and your parents really pushed it on you. And a therapist might say, okay, I just want to clarify. What I'm hearing you say is you find your participation in this activity really difficult. Your parents really are passionate about it, and you might feel like they have more interest in it than you do. Is that what you're saying? And they kind of just repeat back what you said, but clarify. They also kind of force people to be more clear. A lot of times people don't say what they actually mean. So by echoing it back and saying, well, this is what I hear you saying, kind of offers people an opportunity to clarify what they actually mean. So the therapist's most important contribution in humanistic perspective is to give unconditional positive regard. There is no judgment in this therapy method. So again, 3 elements to active listening: paraphrase, so summarize the person's what they've said in your own words; invite clarification, so invite them to say more or give more information; and vocalize what you are sensing the person based on their body language or what they're saying, what you believe their feelings are, and offer them an opportunity to clarify if that's not accurate. Now, Rogers himself, the creator of non-directive therapy, even said it's impossible to have 100% non-directive therapy because otherwise you could be stuck in a rut forever. At some point, a therapist is going to have to nudge you in a progressive direction. It's impossible not to. All right, and again, on Google Classroom, there's a link for a crash course on the humanistic perspective of therapy, so please check it out. And I hope everybody's being safe. Bye, guys.